Alright, this video is going to be a recording of a cardiovascular and peripheral vascular exam of my patient. So to start out, we are going to be examining the precordium of my patient, so just the anterior chest wall. We're examining it for any visible impulses or visible abnormalities, also any skin issues or anything like that. For the next part of the exam, we would then palpate for any lifts, heaves, thrills, or bruits. We do that with the pad of the fingertips and the ball of the hand, and we do that in the same places where we would listen to the heart sounds of the patient. And so that's going to be in the right second intercostal space next to the sternal border, the left second intercostal space next to that sternal border, then the third and fourth intercostal space at Erb's point, and then the fifth intercostal space in that mid-clavicular line. There we would also palpate the apical pulse, or the point of maximum impulse, and if that was deviated, that might be a sign of cardiomegaly or a pulmonary issue or any other abnormality. That could be a sign of that. So then we will auscultate those heart sounds in those same areas. So we're listening to the aortic area, the pulmonic area, Erb's point again, and the mitral area. I'll listen again with the bell. And we're listening, making sure we do not hear any murmurs or any extra heart sounds that could be caused by valve issues, congenital issues, or anything like that. For the next part of this exam, the peripheral vascular system, we're going to first inspect the patient's JVP. So I'm going to have you look to the left. For this, we would typically, if we saw any abnormalities, we would measure the JVP. For this exam, I don't have those correct tools, but when we are inspecting this JVP, we should be able to see a visible impulse. It should not be bounding profusely, and we should be able to see a visible impulse. If someone is fluid overloaded, that may they may have a large JVP. If someone is hypovolemic or dehydrated, we may have to lay them flatter to see the JVP. So we inspect a normal JVP for this patient. I would also, in a normal exam, go and have her look the other direction to inspect the other side as well. Now we will palpate a variety of different pulses. So if you look straight ahead again, I'm going to be palpating the temporal pulse. We're going to palpate the carotid, and we're going to do one at a time. You never want to do both at the same time. We're going to palpate the brachial. When you're palpating again, you could palpate, make sure the pulse is not weak, thready. Make sure, again, you don't palpate for any bruits. Move down to the radial, and then the femoral, the posterior tibial, and the dorsalis pedis pulses. When we go back to the radial, we will perform the Allen's test to test for radial artery and ulnar artery patency. And so for this exam, I will palpate, or for this test, I'll palpate both of the pulses I will occlude them, and then if you can go ahead and close your fist for me, and then open, and I'll release the ulnar, and we should see blood return typically within about 7 seconds or less. And then we'll do the same thing again. Go ahead and close your fist and open, and I'll release the radial, and blood flow should return again. So we see that the radial and ulnar arteries are patent. When we were assessing the dorsalis pedis pulses, we're also assessing for any edema, any swelling. That could be a sign of heart failure or fluid overload, or another cardiovascular peripheral vascular condition. I will also auscultate now the temporal and carotid arteries for bruits. We should not hear any bruits. And do the same thing. Now we're going to do the same thing with the abdomen. With the abdomen, you're always, again, first inspecting, looking for any visible pulsations, abnormalities, etc. So then we will listen to the aortic artery, the iliac on either side, and then the renal, and then we'd also auscultate the femoral. It's going to be difficult to do since this patient has jeans on, but you'd also auscultate there for bruits as well. All right, and that concludes the cardiovascular and peripheral vascular exam. Thanks.